Hello and welcome to this video about sustainable logistics in healthcare organizations. This is your teacher for today, and today we will be diving deeper into logistics and how processes might be a bit more sustainable by using logistical concepts. Our goal is to provide you with a few practical insights to reduce environmental impact, optimize resource use, and enhance patient care. There are probably a lot of things from logistics that can be relevant, so in this video we will only be covering a few concepts regarding purchasing, storage control, and warehousing. So far we have talked about what sustainable logistics can mean and a few reasons why thinking about sustainability in healthcare is important. We looked at what logistics is and what some of the professional logistics operators do to make their processes a bit more sustainable. Route optimization and continuous improvement of processes is important. Maximize capacity utilization in different areas. Working with suppliers to optimize purchasing and making sure suppliers also follow sustainable practices. Packaging is a big area, and in logistics it is important to make the shift towards more environmentally friendly packaging. And the last we briefly mentioned, making energy efficient warehouses, because in logistics, as in healthcare, we have large buildings where a lot can be done to become more sustainable. Sustainable logistics involves managing the flow of goods, services, and information in a way that minimizes environmental impact while maintaining efficiency and economic viability. Now, can some of this be relevant for healthcare, and how? A healthcare worker plays a vital role in ensuring smooth operations and high-quality patient care. Understanding sustainable logistics can help make a meaningful impact on the environment while improving daily work processes. And we will now look at a few concepts from logistics a bit deeper and how it might be applied in the healthcare sector. And now we will explore a bit more of some of these concepts in logistics that can be used on certain processes in healthcare to maybe make them a bit more sustainable. The areas we will focus on, as mentioned, are purchasing and warehousing or inventory control. Small changes in logistics can create big impacts for sustainability. Let's now look at some examples of what a healthcare worker like Julie and Peter can utilize and do regarding things related to purchasing and inventory control. Purchasing. In an organization aiming for sustainability, the procurement activities are given a crucial role in reducing environmental and social footprint, as they mainly control emissions stemming from the upstream supply chain by selecting suppliers, making wider sourcing decisions, and determining collaboration and interaction with suppliers. Sustainable procurement means choosing suppliers and products that minimize environmental harm while ensuring quality care for patients. It means making sure that suppliers follow sustainable principles like the triple bottom line approach we mentioned earlier, so that the whole supply chain are driving towards sustainable practices. Remember all the plastic gloves? For example, selecting medical gloves made from biodegradable materials reduces waste and supports eco-friendly practices. If these are produced, sourced, and bought from a sustainable friendly supplier, more the better. There might be some distance between the people using the products and the people actually making the sourcing and purchasing decisions. If you work in a hospital or a local nursing home, you might not be in the position that make the sourcing and buying decisions. In many healthcare facilities, sourcing and supplier selection are typically managed by dedicated procurement departments. These teams often handle decisions about which suppliers to work with and how much to purchase. However, as a healthcare worker, your role may be focused on placing orders based on established agreements, a process known as call-offs. This means that while you work directly with the materials and supplies, you may be quite far removed from the decision-making about suppliers and procurement strategies. So, what can healthcare workers like Julie and Peter do regarding purchasing, even if they maybe not are the ones that source the products or don't make all the purchasing calls? They can start by asking some questions regarding the procurement process and sourcing decisions. Have we considered whether the products we use daily, such as gloves and single-use items, can be replaced with more environmentally friendly alternatives? Can we explore whether any of our suppliers offer products made from recycled materials or with a lower environmental impact? How do we ensure that the products we purchase, like medical equipment or uniforms, are produced under ethical working conditions? Are there processes in place for providing feedback to the procurement department about products that might be less sustainable than other options? Can we get information or training about which products are the most sustainable so that we can be more mindful in our work? As a healthcare worker, you have the responsibility to ask questions regarding purchasing and sourcing, but not only about which supplier to use and their products, but also regarding how much to buy. In logistics, it is a clear connection between sourcing, purchasing, and how much to stock of all the different items, clothes, equipment, and so on. Let's take a look at the concept of safety stock and optimal order quantity. As a healthcare worker, you may not be directly responsible for placing orders, but you can play an important role in ensuring that ordering processes align with both operational efficiency and sustainability goals. One way to do this is by understanding the economic order quantity concept and its connection to sustainability. The economic order quantity helps determine the optimal order size to minimize total costs related to ordering and holding inventory. In a healthcare setting, this concept can support sustainability by reducing waste, avoiding overstocking, and ensuring efficient use of resources. For example, ordering the right quantities can lower excess inventory that might expire or go unused, which not only reduces waste, but also contributes to more sustainable procurement practices. So, just to be clear, EOQ stands for economic order quantity. It's a calculation used to determine the optimal order size that minimizes total inventory costs, including ordering costs like placing the order and holding costs like storing the items. When ordering too much, excess stock can take up valuable storage space, leading to overcrowding in supply rooms. Items with expiration dates, like medical supplies, may expire before they can be used, resulting in unnecessary waste. Increased inventory levels tie up resources and energy that could be used more efficiently elsewhere, and might lead to mess and cluttering. When ordering too little, frequent reordering can increase administrative costs and carbon emissions from transportation. Running out of essential items may disrupt patient care and create stress for staff. So, how can you help ensure sustainable ordering? Monitor the usage of items regularly and report if certain products like gloves or bandages are consistently over-ordered. Share feedback on what is actually needed based on daily operations to help adjust order sizes. Report any unused or expired items to By contributing to smarter ordering practices, you can help your workplace reduce waste, save resources, and support sustainable healthcare operations while ensuring that patient care remains uninterrupted and the economics stay lean. Procurement is a very important logistical process, and making sure that you have what you need, but not necessarily too much of it, is an important economic factor and hence a sustainable factor. Now, let's look at the logistical concept of warehousing and inventory control. Let's say Julie and Peter are responsible for inventory of consumable supplies. It may be medical supplies such as gloves or bandages, cleaning products such as wipes or hand sanitizers, personal protective equipment, office supplies, basic patient care items like bedpans, thermometers, and torque depressors. It can be consumable medical devices or general supplies. There are a couple of concepts relating to storage and inventory control that are worth mentioning in this regard. It is called XYZ analysis and ABC principle. Let's take a look. XYZ analysis is a method used in inventory management to classify items based on the predictability of their demand. X items have stable and consistent demand, Y items have moderate demand fluctuations, and C items have irregular or rare demand. This helps organizations prioritize how they manage and stock different categories of inventory. Julie and Peter can use this to help organize and prioritize how they manage and stock different categories of inventory. What should be easy to grab and what might stay a bit more in the back. ABC analysis. The ABC analysis, based on the Pareto principle, classifies inventory by value and usage frequency. A items are high value, often used items, while B items are of moderate value and usage, and C items are low value, less frequently used items. Understanding the value of the products you use as a healthcare worker can change the way you view resources. When you know the cost of consumables, like gloves, bandages, or syringes, it becomes clear how waste impacts not just the environment, but also the healthcare facilities budget. For example, throwing away unused or expired supplies isn't just about waste. It's about throwing away money that could have been used for other important resources or patient care improvements. By being mindful of what you use and reducing unnecessary waste, you can help your facility save costs and allocate funds more effectively. It's a small step that makes a big difference in creating a sustainable and financially healthy healthcare system. Both analysis XYZ and ABC allow for smarter inventory management by focusing efforts and resources where they have the greatest impact, on the critical few rather than the trivial many. Takeaways for a healthcare worker. Reduce waste. By understanding purchasing and inventory concepts, you can help minimize waste of supplies and resources. Support sustainability goals. Make informed decisions to contribute to environmentally friendly practices, such as reducing overstock and using sustainable packaging. Strengthen teamwork. Collaborate with procurement teams to align usage needs with purchasing strategies, creating a more effective workflow. Save costs. Recognize the value of consumables and reduce unnecessary expenses by avoiding waste and promoting efficient use. Be a change agent. Your actions can inspire others and play a key role in fostering a more sustainable, efficient, and cost-effective healthcare system. Remember, logistics is not just about large-scale processes and supply chains. It's about small, actionable steps that you can take every day to improve efficiency and sustainability. The journey towards sustainable logistics starts with the awareness and simple steps. Every action you take can contribute to a more efficient and eco-friendly healthcare system, and purchasing and inventory control are two important logistical concepts in this regard. Now, this has been a bit about a few logistical concepts that might be used in healthcare processes. Make sure to check out the other videos in the series. Thanks for watching.